have a wonderful electronic invention I want you to see.
It looks something like this.
Welcome to our special talk session. The topic which we would like to discuss today is the new coronavirus infection. As you know, the United States suffered the most severe damage by the disease. The country has the most advanced technology, especially in the field of life science. Therefore, you might wonder why the US got into such a situation. I will explain one of the reasons for that. We also invite 3 guest speakers to this event. Our first special guest is Mr. Lee Butler. Could you please introduce yourself?
Of course. Sure. Thank you for having me here today. My name is Lee Butler. I have been living in Japan for over 10 years now. I am currently working for an English teacher dispatch company. Before coming to Japan, I worked in the medical field. I am professionally registered as a nurse in the state of Washington, where I worked for many years as a licensed nurse. Part of my work back then was to work with aging and disabled individuals, so providing them with assistance and also with training. I also worked within the caregiving mental health training division and the caregiver dementia training division. Although the work was hard, I really enjoyed it. I come from a very military family, and I also come from a very medical family. My father himself worked as an EMT, emergency medical technician. So this was the main reason I decided to go into the medical field and also to become a nurse. I understand that many students here are undergoing training in the medical field, and this brings back a lot of good memories for me as well. So thank you very much, and thank you very much for having me.
Thank you very much. Lee, can I call you Lee?
Sure. Actually, I prefer to be called Lee. It makes me feel more comfortable and more relaxed.
Great, thank you. Please call me Chuji.
Oh, okay.
Your many years of experience working as a licensed nurse in the US makes me want to ask you many questions. But I know we have some students more anxious to ask their own questions. We will hear from them later on. First, let me give you a quick orientation on what we will be doing today. We divided this special talk session into 3 sessions or movies. As I mentioned, we have 2 more guests. One is from Canada, and the other one is from Australia. You can watch their talks in the other 2 sessions. Before we hear more from Lee, I'd like to share with you some interesting facts about today's theme. Please look at this slide. This slide shows the reported coronavirus case and death by country. The total case in the US are 7,097,937. The total death in the US are 205,471. From this table, you can see that the new coronavirus infection is the highest in the United States. Why is it so? One possible answer is the vulnerability of the US medical system. Please look at this slide. This slide shows some examples of medical expenses in the US. In the US, the first consultation cost is 16,500 yen to 33,000 yen. In Japan, the first consultation cost is about 3,000 yen. So here you can see the difference. Medical expenses are extremely high in the US. Fixing a broken leg can cost up to 825,000 yen. the average cost of a 3-day hospital stay is around 3,300,000 yen. In Japan, the average cost of a 3-day hospital stay is about 60,000 yen. You can see the average cost of hospital stay in the US is about 55 times higher than that in Japan. There is also a huge difference in the medical insurance system between Japan and the US. Japan has a national health insurance program. Basically, those who live in Japan have to pay only 30% of their medical cost. However, the United States does not have such a system. As you can see from this graph, currently about 30 million people in the US do not have the health insurance. Those uninsured people have to pay 100% of their medical cost. According to an article which was published on April 1st this year, uninsured Americans could face nearly $75,000 in medical bill if hospitalized for coronavirus. $75,000 is 8,250,000 yen. By the end of March, more than 140,000 coronavirus cases were confirmed in the US. However, at that time, those uninsured Americans were reluctant to go to hospitals or other medical institutions because of the extremely high medical cost. This makes it very difficult for the US government to control the disease during the early stage. In the early April, Trump administration announced that the government will pay the bill for treating uninsured coronavirus patients. Since then, the situation has been gradually changing. Anyway, you can see that the medical system in a country could have a great impact on responding to the infectious disease. Okay, now I would like to ask Lee his opinion about this issue. Lee, what do you think about this issue?
Great. So thank you very much, Suji. So I've read and observed Suji's arguments, and I have looked at his presentation. So one thing that we need to look at before we really answer these questions is something called the American Medical Association, or it's called the AMA. Also, coronavirus, it is continually changing. It's gone from a epidemic into a pandemic. One of the main reasons why the American insurance system doesn't really work is because of something called the American Medical Association, or the AMA. It also has to do with the government. Depending on which party wins the presidency determines how much progression or digression will happen inside the healthcare system. Democrats, for example, they usually tend to want to go towards more of a socialist health insurance system. What this does is it takes away control from the AMA, and it puts more control inside the government to make choices. Now, on the opposite side of the spectrum, when we put the Republican Party in charge of, the health insurance system, we want to give back control to the AMA. So there are some reasons why the AMA does have a lot of power and a lot of control. The first is that they are healthcare professionals. They are doctors. They are professionals. They can make medical choices. Second, the American Medical Association, they are the largest lobbying constituents that we do have in the U.S. Okay. Also, when I think about Japan's health insurance system, I think it is a wonderful thing. I think it is excellent. So it's straightforward. It's mandatory. It is easy to get. It doesn't take out a lot on top of the people. It wants to help the people. Okay. Suji also asked me, about the coronavirus. So, coronavirus, it has turned from an epidemic and into a pandemic at a very alarming rate. Transmission rates mortality rates have significantly increased. But one thing that I have noticed about the coronavirus is that it is manageable. It is manageable by intubation. It is also manageable by mechanical ventilation. We are now seeing how the virus moves throughout the body and also throughout the individual systems inside the body. Testing, as of now, we have developed more progressive testing with our qPCRs, or real-time polymerase chain reaction tests. So thank you very much for the question.
Thank you. I think that what you just said is quite valuable for our students because you have abundant experience as a licensed nurse in the US and you also have lived in Japan for a long time. You must be familiar with the medical system in Japan by now. How do you analyze the current situation in Japan?
The situation, it does fluctuate. And as far as Japan's insurance system, I love it. When we think about testing being done in America and in Japan, we need to take into consideration some key factors. So while in America, the testing results, they're free, right? It's the administration costs. It's what you pay right at the counter that's killing you, right? It's also the treatment. Coronavirus, you get tested for it, that's fantastic. If you don't have insurance, and you need to get assistance for it, apparently you can get help with it. But if you do have insurance, that's where you're getting charged. Knowing that you have the virus, it's nice, but, paying a high deductible really, really hurts, and, with the pocket. There are also situations of knowing that you are infected and also that you have insurance, but you are unable to pay for the treatment and that you are unable to pay for the care. In Japan, we see that administering this, qPCR, they're free. Also, if the results come back negative, you're just like, yeah, nice, I don't have this virus. But if you do come back positive, if you do have this, virus or coronavirus or COVID-19, you know that you are going to be treated well, that you are going to receive the best care possible. Thank you very much.
Now we would like to take some questions from our students. My name is Yuko Asahi. I work at Center for International Research and Education. Our first question is from Saki.
How can you explain the increase in coronavirus in the US? And how can we compare that to what is happening in Japan?
Excellent. So Saki, thank you very much for that question. I do appreciate it. So from what I hear is you want to know, how else can you explain the increase in coronavirus in the US? And also, how can we compare that to what is happening in Japan now, correct? Thank you. So, good question. Why are we seeing low numbers in one country? And again, why are we seeing higher numbers in another? So one thing we have to take into consideration is the population size. So when we are dealing with America, we're looking at roughly around 330 million people, which is a significantly large amount of people. When we're looking at Japan, we're looking at about 126 million people. So population size, it does make a significant impact, concerning testing. So the total number of tests, just from some research I did as of September 13th, as of this year, for the U.S., for the qPCR tests, we had administered 91,703,503 tests. In Japan, the number of tests that they administered was 1,703,734 tests. So we can see that America, or the U.S., however you want to phrase it or call it, we are doing a lot of testing, and that Japan is also doing a lot of testing. But in general, to answer your question, population size does have a lot to do with the testing ratio and the mortality ratio and so on. So thank you very much for your question.
Thank you for that good question, Saki, and thank you, Lee, for your answer. We will take another question from June. Please, what is your question, June?
What is your feeling in general and these insurance systems in the US and Japan?
Okay, so June, thank you very much for the question. So you want to know, what is my feeling in general about the insurance system in Japan and the insurance system in America. And so to be honest with you, I feel that, Japan, they set the model form. They set the perfect example on what the health insurance system needs to look like. It completely helps out the Japanese people, and it also helps out foreigners. I have been to Japanese clinics, Japanese hospitals, and I've been treated with the most professional care. And I've not been worried about, paying lots and lots and lots and lots of money. While in America, I think America, I love America, it's where I'm from. But we do have quality care, and we do help our citizens. But one thing that is not working right now is the American health insurance system. It just doesn't work. It's broken. Our doctors are good, but our insurance system is not working. I found it very difficult to make choices on what kind of care, what kind of treatment. I also found that laws are continually changing. And, from a very personal experience, I found out that it is very, very expensive to have. So, June, I hope that answered your question, and thank you very much.
Thank you for the good questions from our students, Saki and June, and Lee's answers. We would like to end this first session by saying thank you to all of you who participated in today's session. I also would like to give a special thanks to Lee Butler.
Thank you very much.
Thank you very much. Don't forget, we have 2 more sessions coming up with 2 more guests from Canada and Australia. Bye.
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 Thank you.
Thank you.